Our lead story is about how thousands of people died when the NHS used imported contaminated blood in the 70s and 80s, and we meet the Essex family directly affected.
You're listening to Sadie 9. Call 0300 200 40 41. Tweet at BBC Essex. Text 81333 and start your message with Essex. BBC Essex.
Coming up to 7 minutes past 8 o'clock. It's a scandal that's been going on in this country for more than 30 years. In the 1970s and 80s, contaminated blood projects. Now listen to this if you don't know. If you're a young one, you're thinking, what are they talking about this for? Listen to this. Contaminated blood products were used in hospitals, leading to the deaths of nearly 2,500 people. Thousands more were left with serious illnesses like HIV and hepatitis. And finally, this week, the Prime Minister announced an inquiry into what happened. Finally, someone who has been directly affected by the scandal is Angela Farrugia from Hadley, and she joins us on BBC Essex now. Good morning to you, Angela.
Good morning.
Thank you so much for talking to us. You were also joined by your nephew, Tony. Morning, Tony.
Good morning.
So tell us, first of all, Angela, if I may, tell us your story and what happened.
Well, we was one big family, and then suddenly Barry became ill. The three brothers were all mild haemophiliacs. They went to work, they lived relatively normal lives, and then this new treatment came in that actually they was promised to be normal if they took this treatment, which it was effective, the treatment, but no one told them where this product was coming from. You know, prisoners in the Arkansas prisons were infected already. Nobody did health checks on them patients when they took that blood. The drug companies did it purely for profit. So Barry became ill, and ultimately it killed him. HIV and hepatitis. Left a family of 5 children. The youngest one never even knew his dad, really. He was too young to remember. My nephews have campaigned for years to try and get some answers, and what they're uncovering is just really incredible, to think that they put profit before human lives.
Because what happened was, because I haven't sort of described it, but American prisoners gave blood. The UK government bought it. It funded the prison. And this blood was infected. It wasn't checked out at the time, and it was given to people.
No health checks were done on those prisoners. And from what I've uncovered so far, it seems that they were obviously infected. Some of them were yellow and they were taking blood from them. All for profit, you know.
When was it first
realised? And then in 1991, it turned out that my brother David was infected back in the 70s with hepatitis. He carried on relatively normal, but for the past 10 years of his life he was so unwell, and he passed away in like 5 years ago.
So let's bring in Tony, if I may, as well, because this is your nephew Tony. Tony,
yes.
What were the effects on you? How did you feel about this? Did you even know what was going on?
At first, we didn't know what was going on. Dad started to feel unwell around about 1983. I think July 1984, the doctors actually told him that he had non-A, non-B, which is now hepatitis C. They tested him for HIV, as far as I'm aware, without his consent. The results came back, but they were withheld for what seems to be another 7 months before he was told. And in between telling him about the hepatitis C and the HIV, I was actually removed from the family home and placed into care. We obviously know, looking back now, that the reason this was done was to get his children safe, to make sure that we were going to be looked after. He clearly knew he was dying. So it's actually been awful. It has been an awful time. We couldn't speak out. I never actually told anyone or went public with this until about 2014.
Why was that? Why did you feel that you couldn't talk about it?
The stigma of HIV around about the time my father told me, when I was 14 years old, it was front page news. It was being described as a gay plague. So it made it very difficult to speak out, because you were assumed that you were either homosexual, a drug addict, or you were promiscuous within a relationship and sleeping around. That's how it was portrayed. A couple of days after he died, my twin brother was also taken into care. We've since found medical notes in Dad's medical files that they were actually discussing with him in May 1986, or not even with him, but between the social workers and the doctors at the hospital, to actually remove his children and place them into care when he died. And that actually came to, it actually happened. They followed through with it, and the children were all separated. We weren't reunited until the 2nd of August 2010, which was 24 years after he died. That was the first time that all 5 of his children actually got back together. We were so separated and spread across different parts of the country, and being children, we lost contact with my 2 elder brothers and my younger brother.
It's how did you feel about this? I want to ask both of you this, that this has gone on for so long. I have to say, and my dad was in hospital, and we were terrified because he got very, very poorly, and we were terrified that he'd been given contaminated blood. And we asked the doctors, and they said they had tested him for AIDS because he had had a transfusion. They said, and this was going on at the time. But I can't believe this wasn't dealt with. I mean, we lost my dad in 91, and you know what I mean, you sort of forget everything around that. Then you just don't deal with it. How has it gone on so long?
I think for us, because of the stigma, and not only that, we wasn't just dealing with one death. We were dealing with a second death a few years after, when Uncle Vicky was diagnosed with HIV as well. So for us, it destroyed the whole family, and because of the stigma, we actually didn't speak out. We spoke out within our family group, but we never went public with it until about 2014.
How did it affect your dad as well? Because I know that these deaths as well were dealt with. I had a good friend who died of AIDS in Germany, and they treated him as if he was an absolute, I would say, leper, but actually worse than that, because they would know by that time you can't catch things. But he was dealt with men in big white coats and big white gloves and everything.
My father was sectioned under the Mental Health Act 6 months before he died. Basically kept in a locked hospital ward. We never saw him again after he was sectioned. We didn't get to see him after he passed away. He was pretty much bagged up. Within 5 minutes of his death, the family were told that he was removed from the ward because of the risk to other patients. And the struggle wasn't just there. Even the funeral itself was a struggle, trying to get my dad the treatment that he should have required after he'd passed away. We couldn't even get that. There was no embalming. They refused to do it, which left the family unable to go and see him. So we actually denied the right to say goodbye.
This scandal has been going on in this country for more than 30 years. In the 70s and 80s, contaminated blood products were used in hospitals, leading to the deaths of nearly 2,500 people. Thousands more were left with serious illnesses like HIV, hepatitis, AIDS. Finally, this week, the Prime Minister has announced an inquiry into what happened. We're on the line at the moment with Angela Farrugia from Hadley, and also her nephew Tony, who are talking about this. They lost 3 members of their family to this scandal. Can I ask you, Angela, first of all, I mean, are you angry about this? You sound almost resigned to it. I mean, you lived with it for years. Are you still angry over it, or are you you've given up? How do you feel?
Very, very, very angry. Very angry. You don't ever get over it. You just get used to them not being here, I think. But we've got no answers yet as to who made the decision to keep administering this filthy blood when they were warned about it. That's what we want to know. We want to know who made the decision, why they made that decision. These were people's fathers, people's sons, people's loved ones. You know, how can you put profit before lives?
Tony, how did you feel when you heard that finally there's going to be an inquiry?
Obviously, the initial reaction was jubilation. We were ecstatic. We've been campaigning for decades to try and get the government to be held to account for their wrongdoing. We are still concerned. There is still a quite a lot of concern within the community that this inquiry may not bring us what we actually want. The remit of the inquiry still has to be set. What we're hoping is that the inquiry will have the remit to compel witnesses to give evidence under oath from the NHS, the civil service, the ministers responsible at the time. It has to happen. You know, we have to have the remit within this inquiry to get to the truth. Penrose inquiry, unfortunately, from the start was blighted in the fact that the inquiry's aims were that no blame would be laid, which it wasn't. So it didn't actually deal with the problem. So we hope now that the Prime Minister will listen to the families and that the inquiry will have the issues that we need it to look at to actually receive the truth and justice, and hopefully criminal prosecutions for the people responsible. That, you know, they should be in jail for what they've done. You know, it's murder. It's clear and simple. It's murder. They were fully aware. As soon as they were fully aware, they should have made the patients aware of the risks so that they could have made their own choices. Our family are mild haemophiliacs, and from going back over my father's medical notes, from when he was born right up until when he was first infected, his haemophilia treatment was practically non-existent. You know, this was a mild haemophiliac who got run over by a car, who fell off his motorbike and broke his collarbone, and no treatment was administered. And yet in 1977 they switched him over from a perfectly safe product to a filthy product without warning him of the risks, without giving him the choice. He could have sat at home as a mild haemophiliac with a bleed. He could have treated himself with a cold compress, bed rests and strong painkillers. And he wasn't given that choice. He was actually put on prophylaxis, onto home treatment, where they actually encouraged him to treat himself before a bleed developed. So he was basically administering this treatment to prevent a bleed. He didn't need it. I've actually got a letter in his medical notes where the doctor in 1977 wrote to the consultant that gave him the factor VIII, asking, why has this man been given this medication? He doesn't need it. He doesn't need it.
Is the worry, Angela and Tony, is that this is so far down the line now that lots of these people who did dealings with this have either gone or left the profession, if nothing else, or even maybe died? Because we're talking a long time ago. Has this inquiry been called too late, do you feel, Angela?
Well, I certainly hope not. It's not for the lack of trying. My nephews, as I say, have been campaigning for years, and whoever was responsible, surely, you know, that there's records. You know, we just want to know. We have a family member still, a cousin who's infected. He has a family to support. If anything happened to him, you know, he's got that. It's the mental anguish that they go through as well once they're infected, as, you know, what's going to happen to their family, etc., etc.
Do you want
My brother left a grandchild with haemophilia. We want to know that it can never happen again.
I think that's the main thing, isn't it? To make sure this never happens again. Because having been a family who were torn apart by worry, thinking, has my dad had that blood given to him? I can only imagine what you went through when you found out it did. Do you want compensation, Tony?
We definitely want compensation for the harm that's been done to us, for the pain and suffering. The fact that I was taken from my family and placed into a care home. I had the right to a family life. My father also had the right to a life. That was taken away from my father and his children. Yes, we definitely want compensating. It's long overdue. It should have happened. It should have happened right back when this first came to light in the late 80s. But unfortunately, the government have covered it up. They've done a very good job of covering it up.
Well, I thank you very, very much indeed for joining us. What a frightening story. Angela Farrugia and Tony Farrugia, thank you very much indeed for joining us, and good luck in your battle. Thank you.
Thank you.
Thank you. Thank you very much.
I can only ask for your comments. What on earth do you do with something like that when you hear something like that and you find out that you've lost that loved one and they went through all that and actually they didn't need to?
This is BBC Essex.
Alan's in Epping and dialed 0300 240 41. Morning, Alan.
Good morning.
What did you want to say, Alan?
Well, basically, I appreciate, obviously, loads of people have died through these hepatitis C. Unfortunately, both of my sons are haemophiliacs. They both contacted hepatitis C obviously, when it was having the blood transfusion. One is now 46. He never got married because every time he meets a woman and gets close to her, he's telling her she's got hepatitis C and she decides that that's not what she wants, sort of thing.
Right.
And the other one, my other son, unfortunately, has now got cirrhosis of the liver. So therefore, his time and date we don't know, or how serious it's going to get, obviously. And there's no time on it. But, there's loads of... What I'm trying to say is that, fair enough, I agree that, obviously, the people that have died is worse. But there's also so many people out there which have contacted hepatitis C and are having to live with it
Right.
for the rest of their life.
Mm.
And, it's, the government just don't seem... In other countries, they've had massive payouts like Ireland and I think Scotland as well. But in England, they did get a small payout, but not a lot, and it's and they've had to live with it for the rest of their life.
Mm. And were they infected with it during a transfusion then?
Yes.
Right.
Factor 8. It was factor 8 when they was children. Right. I can remember sitting in the London hospital watching them inject all this factor 8, which is not very pleasant, but anyway. But it kept them, obviously it stopped them bleeding at the time. But basically I just wanted to ring up and say that it's not only the people that have died, it's the people that have contacted it and they've got to live with it for the rest of their life.
Well, as the family was saying as well, they've got another family member who's affected but hasn't as yet lost their lives. Alan, I thank you very much indeed for adding that into the equation as well. So that, this isn't just people who've lost their lives, this is people who are living with it. I look at things like this, and I remember when we were so worried, we were all too nervous to talk to each other about it, and we all individually asked my dad's doctor, could it be, has he got that, please? Because at that time as well, and as you were hearing from Tony and Angela, nowadays someone could say, oh, I've got hepatitis or I've got HIV or I've got AIDS or whatever, and you'd sort of go, oh, right, okay, that's dreadful, what are you having, blah, 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 and you would treat it. In those days, it really was a thing where people thought if you touched someone who had AIDS or HIV, you would catch it. Watch the film Philadelphia. I mean, we forget what it was like. Do you remember the big adverts where it was, this massive big chasm opening up, AIDS, it's going to wipe out humanity. I remember those adverts. It wasn't a thing that you could tell people. It wasn't a thing you could say, oh, I'm really worried that my dad might have HIV or AIDS, because it was absolutely, it was like it was just a dreadful thing to get. And so there was this stigma around it, which was horrendous, absolutely horrendous. So my sisters and I all separately asked the doctors, could you check him? Because it would have destroyed him as well. Destroyed him, and thank God he didn't. I mean, we lost my dad anyway a couple of years later, but to have that, and so I do understand exactly how that family feels and how now people are still living with this, and it's got to be dealt with. 2,500 people died. 2,500. So the inquiry, we will keep an eye on it. We'll let you know as to what happens and when it happens. Obviously, here on BBC Essex, we keep you up to date with all the news as it happens. But something like that, especially affecting so many people and probably so many Essex people as well, we will keep you up to date with that. Coming up after the news, we'll continue. We'll go back to Lollipop Ladies and Spiders, I think, because we need something a little bit brighter to make us smile during the day. But right now, it's the news headlines time at 8:30 with Sonia Watson.
BBC Essex.
Thank you, Sadie. Good morning. An Essex woman whose 3 brothers died after receiving contaminated blood says it's destroyed her family. Haemophiliacs and others were infected with hepatitis and HIV from imported blood products in the 1970s and 80s. Angela Farrugia from Hadley says she'll never get over what happened and welcomes a new inquiry into the NHS scandal.